Hi, glad you could join me today. My name is Dr. Lalezari. I'm a general and bariatric surgeon based out of Los Angeles, California. And I'm going to be talking to you today about what you need to do to prepare for any kind of surgery. Now, there's all sorts of surgeries and surgeons out there, but these are some key tips that you need to know to discuss with your surgeon prior to surgery. So now there's three important aspects of your surgery that need to be addressed at your preoperative visit. Most surgeons will schedule a visit with you prior to proceeding with surgery. This visit should occur anywhere from within a week or 2 weeks prior to your surgery. Now, at this appointment, it's important to discuss things like what to do with your medications, what to do with your hygiene, and what to do when you arrive at the hospital and when to arrive at the hospital. So now, in terms of your medications, there's very important medications that some people are on. These include blood pressure medications, medications for diabetes, and just general other medications, especially medications that involve blood thinning. So now, for your blood pressure medications, for the most part, it's okay to take your blood pressure medication in the morning with a little sip of water, just enough to swallow the pill. Diabetes medications, for the most part, you should not take the morning of your surgery. Blood thinners, now these need to be held anywhere up to 5 days prior to your surgery. So it's very important to discuss these particular medications with your surgeon. Let them know, remind them what medications you're on, and ask them when you should hold them. Now, you may have a visit with your primary care doctor as well, which you could discuss these with them as well. But again, it's very important for your surgeon to know. Now, what you're gonna do to prepare the day before. The day before surgery, it's very important not to shave any part of your body in preparation for the following day. Your surgeon and his staff will take care of that for you right before the operation. Now, if you want to shave, wax, or anything else you want to do, you can do it about a week before, but 24 to 48 hours beforehand, you do not want to do anything like that because that increase your chance for an infection. Now, nail polish and things of that sort, you want to avoid having nail polish, especially acrylic nail polish and metallic nail polishes. You want to make sure to remove those prior to the day of your operation, and remove fake nails as well. These sometimes can interfere with the devices that the anesthesiologist will use to gauge your oxygenation of your blood. So now again, it's important to take those fake nails off and remove any of those fake nail polishes that are either acrylic or metallic based. Now, hygiene, very important before surgery. Definitely want to shower the night beforehand with a chlorhexidine based solution. These can be bought over the counter at most pharmacies. And you want to ask them for this. It's chlorhexidine. The trade name is Hibiclens, is one of them. Now you want to pay particular attention to your armpits and groin area and the surgical site wherever the surgeon will be operating on. Those particular areas are very important to clean with this solution the night before. Some places also sell wipes, and you can wipe down these areas the morning of the operation as well. The other thing to keep in mind is your belly button. You would not believe the things you find in someone's belly button. So you want to make sure that you clean out your belly button. Your surgeon will love you for this. Get a Q-tip with some chlorhexidine solution, or even water. Soap and water is fine as well, and clean out your belly button. That also decreases your chances of infection. Now again, your surgeon and his staff will take care of this right before the surgery, but it helps if you do it the night before. So jewelry. Jewelry is another one. Don't come to the hospital with jewelry. You want to make sure you keep all your valuable possessions at home and don't bring them to the hospital. Remove all earrings and body jewelry. It's very important not to come to the surgery with body jewelry. Now, sometimes people have nipple rings or other rings. The devices used in surgery can cause burns to these areas if you have them in place. So instead of the surgeon or staff removing them right before surgery, remove them and keep them in a safe place. The safest place is your home. Now, let's see, what else should we talk about here? When to eat. Now, this is the tough part before surgery. If you have a first start surgery and your surgery is anywhere before 9 a.m., for the most part, you should stop eating or drinking at midnight. After midnight, no more water, no more food, just wait until after surgery. Now, these guidelines vary depending on your surgeon and where he operates and whether or not they practice enhanced recovery pathways or not. Some people allow you to drink clear liquids up to 2 hours before the operation and actually helps with recovery. But again, this point is very important to discuss with your surgeon when you see him on your preoperative visit, when you should stop eating or drinking anything. Now, when to arrive at the hospital. Your surgery may take place at the hospital or an outpatient surgery center. For the most part, most hospitals want you to arrive 2 hours before your surgery. Now, this is important because you need to register, you need to get stuff filled out, then you start IVs, and all these things need to take place prior to your scheduled surgery time. So discuss with your surgeon when your scheduled surgery time is and when you should arrive at the hospital. These will be two varying times. Again, 1 to 2 hours before your scheduled surgery time is when you should arrive at the location where your surgery is taking place. Important not to be late because that throws off the schedule for the entire day. Now, there's various other cases that may arise in surgery times or a loose approximation of what time your actual surgery will begin, but again, it's important not to be late. You could also discuss with your surgeon the best place to park at the location, how much those parking costs are, and the directions to the location where they need to be. Some surgeons may have a handout. If you're one of my patients, I have a handout on my website, and I also have a list for all these preoperative things you need to do before surgery as well. You can pick those both up on my website. It's www.lalezarisurgical.com. There'll be a link below. Now, the other important thing is getting to the hospital. You need to have a responsible adult be able to drive you to the hospital and pick you back up. More importantly is to take you home from the hospital. When you're having general anesthesia, you'll be a little loopy and cannot drive. And you need someone reliable to take you home and make sure you're safe. So it's important to schedule someone to help you that day that could take you home. Now, these are all general recommendations on what to do before surgery. These are the most important things you need to discuss with your surgeon and make sure you have written down and planned out prior to going to the hospital on the day of your surgery. Surgery can be a very stressful time. People tend to forget. I have a handout again that I give all my patients prior to surgery where all these things are listed out. So again, ask your surgeon if they have one. If they don't, you could look at mine. The medication that we should discuss as well, anti-inflammatory medications like ibuprofen. Even ibuprofen, Aleve, things of that sort thin your blood as well. So you should discuss those as well with your surgeon. I know they're over the counter, but again, they increase your tendency to bleed. So very important to discuss with your surgeon. Now, if there's anything else you want me to discuss in these videos, let me know, leave me a comment, and I'll make sure to address it in a subsequent video. If you enjoyed this video, please don't forget to subscribe and hit like. We'll be back doing more of these, hopefully on a weekly basis. If you have any questions, feel free to email me, reach out to me on Instagram, it's Dr. Lalezari. Keep in touch. Thanks for watching. See you soon.